Welcome back to Cancer Buzz. I'm your host, Summer Johnson. On this quick episode, an ACCC project that aims to improve pathology reports for both clinicians and patients. Dr. Timothy Craig Allen is a professor and the department chair of pathology at the University of Mississippi Medical Center. He also leads ACCC's advisory committee on pathology. He says the key to moving precision medicine forward is simplifying and standardizing pathology reports.
My passion is my patients, and my passion for me is my lung patients, and often lung cancer patients. I spent many years in my career when the diagnosis of lung cancer was the end of the road, and there was little else could be done. Now we have molecular era, amazing therapies. We must get people tested. We must get them treated if their actual markers are present in their tumors, or the immunotherapies work if their markers show it. But for that to occur, patients need to be better informed and own, to some extent, if not as fully as possible, the progress of their therapies and the progress of their prognoses by understanding just where they stand. And I think, frankly, all of us are afraid of the unknown. So bad things happen, but if we know what's going on, we can have a handle on that, then people can put a game plan together, and I think are able to tolerate cancers and things much better than if they're unsure, they don't know what's going on. Families don't either. Then people get angry. All that, I think, can be settled down a whole lot if we just make it very clear to the patient and to families on occasion, just exactly where they stand with their tumors in a way that they can understand without having to go to medical school.
Dr. Allen, what are some of the challenges with the current format of pathology reports?
Well, I think that when we're putting together our pathology reports, traditionally, really historically, these have been written for our colleagues who do the biopsies, do the resections, do the surgeries, or are the treating physicians in oncology, for example, or hematology, who are going to be treating the patient. And so our reports are built to diagnose in scientific, really medical terms, and illustrate to our colleagues directions to go, stages of disease, things like that help inform at a physician level the diagnostic features and the prognostic and even therapeutic features. And especially now that we've entered our new, not even that new anymore, molecular era, for me in lung cancer, which is my focus, but other cancers as well, we're seeing that there's a lot more material there in terms of prognostic and therapeutic biomarker studies for tumors. And these can be confusing even for our colleagues because it's such a fast-paced environment right now. So imagine our patients are seeing these reports and they don't know what's going on. They'll call their oncologist or call their primary care physician, who may not know either. So it behooves us as pathologists to be the physicians to our patients and do what we can to clarify these very complex diagnoses and prognoses in a way that's not incorrect. We can't water it down, so to speak. But to me, it's important to try to use, as best we can, terms that people can understand and be very standardized in that language. I also make a point, not infrequently, to make a note that the patient would like to see the case with me or would like to speak with me about the diagnosis. Now, I'm not going to talk about treatments and prognoses and things. That's not my purview, but I'm happy to discuss the molecular features or the histologic features of a neoplasm. So please call me or come by and be happy to show it to them or talk to them about it.
What needs to change to better utilize pathology reports in shared decision-making?
Well, I believe patients need to understand them. These can be very complicated reports, sometimes many pages long, and it can be distilled down into a diagnosis with various features, a stage of disease, and some molecular diagnostic reporting all into one. To me, it's nice to have it in one sort of summary or one box. And yes, the report can still go on for many pages, but I think that's really where the heart and soul of the report really is. What we often have, though, is a report that's sort of scattered. That is, we have a diagnosis and then a little bit about the features, perhaps, in a stage, and then another page down the road in some small print, there'll be a molecular diagnostic finding, and another page over in small print, there'll be two more molecular diagnostic findings, all sort of buried in the verbiage of a report, which is like reading a contract. Either way, I don't think our patients often come away comfortable if they know exactly what's going on. They should know what's going on. one? So should their families appropriate? Because that's where decisions can be made for therapies, for options, and they sometimes need to be made fairly quickly. And this is always done at a time of stress, because by definition, everyone's stressed, and rightly so. So it needs to be as helpful as possible. I think that there are opportunities for us to engage in standardizing wording and engage in tightening up on reports in a way that the patients can actually get something more from them than just sort of a confusion and fear as they dial the telephone to talk to their physicians.
So when you started this effort with ACCC, you really had the multidisciplinary team in mind.
Sometimes we can feel alone in life. And so I'm thinking these things and considering them, and the folks at ACCC are exactly similarly placed. And so to be around colleagues of physician, non-physician, it doesn't matter. All of them I've worked with have been dedicated to the betterment of our patient care. And to be around people for whom they see it that way and want to support that really is heartwarming to me, because we're all human beings. It's easy because we're all busy and hardworking. It's easy to sit and do one's day's work and say, boy, I wish that was a little more readable for the patient. But then we get busy with something else and no one can act upon it. We're too busy. It's human nature. So to find people who are dedicated to working and building a team to help streamline this so that all of us can be a little bit better educators and informers of our patients is a nice thing to have, to be part of, frankly. It's really a privilege to work with them.
For a deeper dive on what was discussed today, ACCC has published 2 white papers on the case for streamlining pathology reports. You can download those on the ACCC website or through the link in the show notes. Thank you for listening to Cancer Buzz. Make sure to follow us on your favorite podcast app to get the next episode as soon as it's published. Until then, for the entire Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.